To all those currently viewing online and those who are still scrambling in after stuffing down a bit of lunch, I'd like to say good afternoon. It is afternoon and welcome. My name is Teresa Maguire and I am Director of the Research Strategy and Funding team here within the HRB. So very much on the kind of, I suppose, the grant giving side where we have an interest in this area, but also representing all of the other elements of our organisation that have a huge interest and a track record in this evidence for policy space, whether that be as data providers, as those working with evidence synthesis for the Department of Health or otherwise. So I have the privilege of being in the chairing seat today, but it is on behalf of our colleagues. And indeed, this is the next in our HRB Evidence for Policy series, which I'm very grateful to our communications team for assisting us in this, where we really are have the privilege of listening to perspectives from people that we might not otherwise hear about, different perspectives on evidence for policy, research and policy engagement, science for policy, whatever language you have on it yourself, and regardless of what perspective you come from. Are you a researcher trying to figure out how to do more and do better in that space? Are you an institution trying to figure out how you set and build capacity and capability and support that? Are you in a policy department? Are you in some other key decision-making role? Are you in health? Are you out of health? As we know, many decisions that are important for health often stem from departments associated with, but not necessarily in health. Are you a member of the public who has a huge interest in this area? And this is really what this Evidence for Policy series is about. And all of this is leading us to and culminating in a national conference that we're going to hold on this issue on the 3rd of December in Dublin. And for those of you who are online who are not aware of that or who haven't yet registered, just a little plug to say we'd love to have you join, get you involved in the debate and the discussion. So please do register. Do look on the HRB website and our social channels where you will see what's coming up. But you will also be able to view previous speakers and contributions in our Evidence for Policy series. So please do look at our website, our YouTube page, and so on. And indeed, important to say that today's webinar itself is live. And thank you for joining and taking the time to do that. And hopefully we'll get your contributions and your questions later on in the session. It's also being recorded and it will be available on the HRB YouTube page. So please do take a look at that afterwards. Another small bit of housekeeping before we introduce you and get over to the real meat of today and really getting into the discussions. That is just to say that for the purposes of submitting your questions, we're using Slido. Suzanne has put the code number for Slido in the chat. It's 362-6881. So please look at that in the chat. You can, if you don't have that available to you, put something in the chat. But I suppose as the chair for today, in the space of an hour and trying to get the best out of this, I would ask that you try to put it via Slido, because I can't guarantee that I will get to see your question in time if you put it in the chat. And final point on housekeeping, but an important one, live captions have been enabled for this webinar today for those of you who wish to use it. So we're here until 1 o'clock, and like I said, I want to get straight into the discussion and make use of your lunchtime. And so our speaker today, we're delighted that Professor Kathryn Oliver has agreed to speak to us today. Her name came up repeatedly at the risk of flashing her in dispatches when we were talking about planning for the end of year conference and for the series throughout the year. She is somebody who has contributed greatly to, I think, the debate on what I'll call evidence to policy or evidence for policy. But more than that, I mean, I think, you know, this is a space where people can talk a lot. But Kathryn is somebody whose name came up repeatedly as somebody who's actually walking the walk and really leading change, guiding, supporting, connecting, And indeed, something that we're very interested in as a funder, really growing the evidence base and encouraging others to grow the evidence base around what works in this space and what doesn't, and constantly evaluating as we go. And indeed, talking about a research agenda on the evidence for policy space. So that's something that we've really been taken by. And Kathryn, I can't cover all of your affiliations and work over the years, but a little snapshot would be Kathryn is a professor of evidence policy in the London School of Hygiene and Tropical Medicine in London. She co-directs the Transforming Evidence Initiative, and I know many of you on the call will be aware of this. For those of you who are on the call who aren't aware of this, I would say look it up after this. A really beneficial and valuable. You may definitely benefit from it, and perhaps encourage people to join from Ireland and contribute to it. Kathryn is director of the Policy Research Programme. And again, for those of you on the line, it's I suppose what we're trying to do here in Ireland in a kind of a pilot basis with our new evidence for policy programme. So that's really exciting and a good connection there. And indeed, you have like a huge amount of experience in working with local government, with central government, and I know that you've been supporting the government in England in relation to thinking about science advisory structures and things like that. Now, I could go on and on and on, but I won't. Hopefully, in the short amount of time, actually, we could talk to you all day and all weekend on this issue. But in the short amount of time we have today, Kathryn is going to give us flavour of work that she has done, her thoughts on the issues, and some insights, guide us to some resources and so on. And in particular, she's going to talk to us, a very interesting title, on areas of interest, joining the dots between research and policy. So I'll say no more on that. Let Kathryn do all of the talking. And, in about 35 minutes time or so, we will be opening the floor to questions. So please do get your questions in as Kathryn is talking. But in the meantime, Kathryn, over to you. You're on mute.
I'm on mute. Someone's got to do it. I do. Right. So hopefully you can see my slides. Does that look right? Oh, no, you can't see them. Does that look right? Or do I need to switch displays?
I don't think it's in presentation mode. We can see the entire
How's that better?
That looks good. Oh,
okay, great. Thank you for your patience. And thank you very much for your welcome, Teresa. And it's lovely to be here to talk with you all. As Teresa said, I've spent the last 25 years researching the use of evidence across different policy domains, and most recently, I've been working as a knowledge broker within the UK government, working on the areas of research interest. So I'll come on to talk about those and how they're a really useful intervention to support evidence use in government. But I'll just give you a bit of background before to set the scene. This is a super interdisciplinary space, and really it's a conversation that every academic discipline has with itself. How can we get our knowledge produced, used? And every discipline has got its own terminology for that. So this is helpful in some ways because there's a sort of plethora of approaches used and different terminologies. But it's a problem too, because we end up talking at cross purposes and sometimes reinventing the wheel. But it's a shared interest, and as Teresa said, the idea of transforming evidence is to try and sit in that space, crossing different disciplines, not setting up a new, empire, territory, anything like that, but trying to connect the dots and see what we can learn from each other. And so one of the core questions that drives us is what are the factors influencing evidence use? What do we know empirically about why evidence is or isn't used? Back in 2014, I did a systematic review on this, and at the time, it looked like access to relevant research was a really critical factor alongside relationships. So things like opportunities for contacts, but also, longer term partnerships, collaboration, co-production of research problems, and so on. I've just updated that review, and relevance remains really critical. And, it's an interesting question as to what we mean by evidence being relevant. But there's definitely been a shift, recognizing that relationships are necessary but not sufficient for use of evidence. So we're now moving towards an empirical case for a systems-led approach that thinks about things like career incentives, the need for organizations to take it seriously, the need for leadership to span different organizations and sectors. So I'll come on to talk a bit more about what we mean by system shortly. But in a nutshell, there's been an absolute explosion of research in this area. And, again, this sort of emphasizes why there's a need for something like transforming evidence to try and stop us repeating this there were 2,000 studies basically in this updated review, 2,199 to be precise. And the findings across them were very consistent. So about half of them were from health, but there are a pretty significant number from conservation. When I say a significant number, I mean about 800. So there's a lot of people asking this question, but we're not doing a very good job of learning from each other and therefore doing interesting research about it. The reason this is important is because alongside this growth in research, there's been huge interest from funders, from governments, and from the big global movement finally asking the question, how can we all work together to actually make sure that the evidence that we produce lands where it needs to? And there's been a massive uptick in the number of initiatives and interventions, funding streams, all sorts of things. And a couple of years ago, we mapped the initiative. So this is back in 2019, so it's now a little out of date. But we were essentially trying to identify which organisations and initiatives were actively trying to promote research policy engagement, so what their activities were and if there was any evaluation of impact. And again, found a huge number. The oldest one that we found dated back to the 1500s, but by and large, there's been a very steady increase until the mid-1990s, and at which point we see a huge uptick in the number of initiatives, predominantly led by universities. And in terms of what these initiatives were doing, the activity sits very much in the linear space. So when we talk about linear initiatives, what we mean is activities that are to do with evidence producers pushing evidence out. So we write something, we throw it over the wall, we'll hope someone picks it up. There's definitely been a growth in the number of relational initiatives. So by that, we mean interventions which really take the interpersonal, social aspects of evidence use seriously. So a good third of those were around training courses for decision makers. So, short courses on research methods, that kind of thing, for government staff. But also, building professional partnerships, so long-term research collaborations, providing research infrastructure that would enable trusted and candid relationships to grow up between researchers and policymakers and so on. We definitely see less activity in the systems space, and it is quite hard to imagine what a systems intervention would look like. The examples that we found that we thought were sufficiently systemsy to be coded as that included things like the impact prizes that are offered by several funders, including HRB, I believe, and creating infrastructure and posts. So, for example, posts that sit across university and local government. So there's a sort of hybrid nature to them. And we think those are systems precisely because they think about that connectivity, not just at a one-to-one, person-to-person level, but what it would mean for organisations to work together and for the need for leadership to look across more than one organisational setting. So a huge increase in the amount of activity. However, only 3% of the initiatives that we found had a publicly available evaluation. So we're working in a pretty evidence-free area here about what actually works. Paul Kearney provided us with the phrase, this is a vast, rudderless mass of activity, a phrase that's kind of taken on a bit of a life of its own. So thank you to Paul for that. But the truth remains that the evidence that we do have is pretty much completely useless if you're someone who's trying to think about how you as a researcher might have research impact, what you as a university might do, what you as a funder might do. We don't really have good lessons to share with you on that. And Annette and I, we're both the directors of Transforming Evidence. We frequently get asked, we're a government department. We've got however much, £500,000 to spend on our engagement this year. What should we do? Should we do a fellowship scheme? Should we set up an evidence synthesis program? And the truth is we don't know the answer to those questions. So as a research community, I think we've got some serious questions to ask ourselves. The overall picture is pretty large and growing, but busy rather than effective. And even when you think about the number of initiatives that are ongoing, many of them are competing with each other for the limited attention which government officials have to offer. Often they're sort of based on a desire for promotion of research project findings rather than a wish to address policy needs. So they're very researcher focused rather than being policy needs led. The advice that we give researchers is often based on the experiences of very unusual academics with particularly privileged backgrounds who are particularly confident, who've had very unusual experiences. And actually, I would argue that we need, as a research system, more coordination and a really clear statement about what it is that we're trying to achieve with these different initiatives. Because, they all run with money, of course, but essentially on goodwill and relationships between each other. And if people have bad experiences, then that goodwill quite rapidly disappears, and that would be a real shame. So we have seen this shift, as I said, from a sort of linear model to a systems thinking approach in the evidence use field, even if it hasn't been accompanied by a shift in our practice. But as I said, what do we mean by a systems-led approach? In 2019, I was lucky enough to join the Government Office for Science, which is the UK's Science Advisory Office. I joined in December 2019, so I had all of 4 weeks before COVID came along. And we had a nice, quiet programme of work planned for a year. It sort of evolved rather rapidly. But one of the things that, one of the questions that I got asked a lot when I was there, and again, I did that with Annette Boas, we were approached by researchers who really wanted to help. They wanted to get engaged. They wanted to understand why the government wasn't repeating things that they felt to be empirically the case in the research papers. They had a project they wanted to share, and they wanted Patrick Vallance, our government chief scientist, to be announcing these things, and so on and so forth. And we spend a lot of time trying to explain to people how the science advisory system worked in government, making it clear that there were already lots of formal routes by which government departments accessed expertise and evidence, but also that, for example, the production of science advice, the committee rooms where evidence is discussed, described, debated, and turned into answers to questions that government asks, that's a very different set of activities and a different set of skills than the delivery of science advice to ministers. Those are different jobs. And so one of the reasons we came up with this map was to try and make it clear to people that there's a lot of different tasks involved in the production, mobilization, and use of evidence within the science advice system in the UK. And as you can see these little blobs around the outside. This is such a nice tube map. I'm so proud of it. I can't take any credit for it other than I've scribbled some things on a piece of paper, but a graphic designer turned this into a lovely tube map. And these little dots around the outside, these are all the places where researchers feed in. So there's a multitude of routes that people can use. And they're not always very visible to anybody on the outside. But of course, one of the things you can do when you do have a map, and I'm by no means saying that this is the definitive map, this is the map that we found useful for our purposes at the time. When you do have a map, you can start to ask questions about, well, what are the different bits of it doing? What are the different tasks? What are the different stakeholders? What would it look like if we were all working together as optimally as possible to deliver evidence for policy? And one thing you can do is you can start to come up with indicators. These are indicators that would be observable. So you'd be able to look at, for example, a government department in this case and say, well, what would it look like if it was playing its role as well as possible? And a couple of years ago, I did a project with the Joint Research Centre, part of the European Commission, that looks after evidence-informed policymaking, where they asked me to think of different indicators for different bodies. And these are the indicators that I thought of for government departments. So a really effective government department would be able to say what its knowledge priorities are. And those knowledge priorities would reflect its policy portfolio and its departmental need. They would have people employed within the department whose job it was to think about evidence and who were skilled in finding it and using it. There'd be transparent mechanisms to access evidence that could be scrutinised, and so on and so forth. So in terms of thinking about this as an intervention, we're often not very good at trying to link the outcomes that we come up with the interventions that we deploy. So in the UK at the moment, everybody has been very excited for the last few years about fellowships. Every government department is running a fellowship scheme. Lots of funders are running fellowship schemes. I think DEFRA, so what does it stand for? Environment, Farming and Agricultural Affairs. I think they've got about 400 academic fellows at any one time. So it's a hugely popular mechanism. But the reality is fellowships are good for some things, but not for everything. And, where we're coming up to now, I think probably the next big thing is going to be AI-led syntheses and synthesis facilities. Again, really helpful for some needs, but not appropriate for everything. So what we really need to do is think, well, what is the specific goal that I'm trying to achieve with my engagement mechanism? What's my need? What's the most cost-effective intervention? And then can I evaluate it to understand what the effects were? And part of the difficulty of doing this is, we have this very faddy way of picking engagement mechanisms. As I said, it used to be fellowships, moving towards synthesis. About 25 years ago, it was synthesis again, actually. So we're sort of going around in circles a bit. But it's very hard to articulate what the goals might be, what your desired outcome is, because we're just used to thinking that any engagement between researchers and policymakers must be a good thing. But learning to be specific about what it is that we really need and spending time narrowing that down will help us to draw better lines, better value for money lines between the goals that we might have, which are all perfectly legitimate, and the mechanism of engagement which we might eventually select. Now, a bit of a game changer in this place has been the areas of research interest. For those of you who haven't come across them, they were suggested by Sir Paul Nurse, who is an eminent scientist in the UK, and he did a review of our research councils, of our public research funding system, and basically said, well, look, it's going to be much easier for researchers to produce policy relevant evidence if government says what it is that it needs. I mean, it sounds like a bit of a no-brainer. At the time, he called them statements of need, statements of knowledge need. And when Patrick Vallance came in as the government chief scientist in 2018, he implemented this across government, so that every government department needed to produce them. They needed to be updated so they would remain relevant and up to date. And in 2019, Annette and I were brought in as ARI fellows to try and improve the production of ARIs, make sure that they were as useful as possible for government, but then also to help others outside the system, researchers, research funders, think about what a really constructive response might be. This is an example of some of the ARIs from DEFRA. And you can see DEFRA is a very science-heavy department. It employs many thousands of scientists. They've got a very big R&D budget. They're very researchy, basically. And so their ARIs look very much like research questions. By and large, that's not the case. So this is an example of some different ARIs from 3 different departments, actually. And you can see that they do not resemble research questions. And that's often the first response that we heard from researchers was, well, I wouldn't put it like that. It's not very good research question. And that's not what they are. What they are is signals from government to the research system about topics that they know they're going to need to do something about. That doesn't mean that it's an evidence gap, doesn't mean that it's a research question, a refined, research program, or even a research agenda. These are just topics on which they need some input. So I consider this to be a systems intervention because it's a signal from one part of the research and policy system to another in our case, without any defined approach, but it would require funders, researchers, research organisations, universities, government, all to work together in order for this to have any traction and really generate change. It would both require and generate a systems effect. And while Paul Nurse had this very beautiful vision that the ARIs would lead to increase of evidence, we found that would be true and it could be true, but it requires a lot of work. So even just getting the ARIs produced by government for most government departments takes about a year, maybe a year and a half. That's partly because in the UK, they're generally signed off by ministers. So there's a lot of approvals processes to go through. But the process of talking to all the policy teams, producing a long list of evidence needs, prioritising it and working out what we already know and so on, it's a big job. And then there's this really analytical job around spotting synergies and prioritising themes. A lot of government departments have overlapping policy portfolios and thus overlapping evidence needs, even if they come at it from very different direction. And spotting those opportunities it's a job. Somebody needs some headspace to go and do that. And then there's any number of ARI related tasks or responses which the research community can make that would be really helpful. There's a lot of knowledge exchange could be done. So, as I'm sure those of you who know a lot about social research. We know quite a lot about criminal opportunities and changing patterns of crime. Maybe a round table would be a really useful response to that particular one. Maybe an evidence synthesis, maybe an evidence map. There's different sort of triaging decisions that need to be made. And then for those ARIs where there is an evidence gap, in order for evidence to be used, sometimes we will need researchers to step in and be funded to do new research. Government also needs to have the capability to use it and so on. So it's, as I say, it's going to require a lot of different approaches. Very quickly, I just wanted to run through the common stages that policy organisations typically use. These images and sort of steps you can find in some of the resources on the Transforming Evidence website. And we've also got a short video which walks you through the process. It's only 5 minutes. It is all me talking though, unfortunately, but hopefully some of the resources in there are useful. So the first step is around finding someone who will own the process of doing the ARIs. Some government departments have tried sort of outsourcing it. So they bring in a researcher to, talk to a few people and come up with a reflection of the government's evidence needs. In general, what we found was that the higher up the policy owner for the ARI process, the more embedded the ARIs became across the organisation. So if you had a very senior, for example, a perm sec or another very senior civil servant who was tasked with being the senior responsible officer for the areas of research interest, it meant that when, in due course, when budget requests were being made, the ARIs would be referred to. When the R&D plan for the department was being developed, it would be based on the areas of research interest. And so it became a tool for sort of internal organizational coherence, and really became embedded within other research and engagement activities. Lots of departments used a sort of like a Delphi type process to generate the ARIs. So they'd email everybody in the department, solicit knowledge needs, partly to build awareness and ownership, and then use a transparent process to finalize a shortlist. Generally, people realize that, not everything can make it onto the final list, but if you do have a process and a conversation and a consultation in that way, at the least you can have a conversation with people about why some things have made it on and others haven't. Engaging key stakeholders, so particularly researchers, was really important, and often people did that quite early in the process, partly to raise awareness of the new ARIs, but also to sort of alert funders, for example, that these new topics were coming up. There was something they might want to think about for any strategic calls that they were planning. And also to help you do some of the whittling down. So if you have a science advisory committee or you have a consultation process with researchers, they can tell you that, half of your list, we've already got systematic reviews and evidence briefs on that. No need to have that on. And then publishing and sharing them, having senior endorsement, so by the minister or a chief scientist, helps give them a lot of credibility and traction. Researchers take them very seriously. And as some of you might know, we commissioned a database of the area of research interest where they're all now collated. So that's a very helpful way of raising awareness too. And then there's the sort of after publication bit. And this is the bit that is a bit more difficult because it tends not to be resourced within a policy organisation. So, in an ideal world, we would all choose appropriate, cost-effective engagement approaches, and we'd know what they were. But really, what this looks like for most departments is working with their key stakeholders, their advisory committees and funders to identify reasonable next steps. As I said, generally, ARIs are refreshed probably about every 2 to 3 years in practice because it does take so long to get it off the ground. And there's increasing interest in funders, particularly to understand what the impact of ARIs are. Evidence on that is a little bit patchy at the moment, but anecdotally, it's certainly the case that where there's a decision to be made about between 2 comparable grant applications, the one that cites the ARIs is the one that tends to get over the threshold. So researchers are starting to recognise what an important tool the ARIs are for them as well. Obviously, we had 4 years to work on these things, so we managed to do some really exciting projects. One of them was looking across all the areas of research interest in the UK government. At that point, there were about 1,800, and they fell into some probably fairly predictable themes. One of the most exciting things that happened was that lots of departments realised that they had answers for other departments questions. And so actually there were just opportunities for sharing best practice, having conversations, and the ARIs provided not quite a forum, but a route to those conversations that hadn't been previously visible to people. We found that most of the areas of researcher interest, as in about 80%, could be at least partially addressed through existing evidence. So we've had some really fascinating conversations with funders around this. We did some work with the National Institute for Health Research, where they asked us, while we're in Go Science, to find all of the health-related ARIs. So the NIHR exists to support our Department of Health and Social Care to do research for that department only. But they're also interested in the wider determinants of health. And so when we looked across, we found obviously health-related ARIs from transport, work and pensions, home office, I mean, you can imagine. So, all across government. And we gathered them together. There were about 44, I think, questions, and they managed to find completed projects and papers that were relevant to about 2/3 of them, which we could then just share back directly with other government departments. So that was a huge diplomatic win for DHSC, actually, and a really valuable exercise for all of us. They're taken increasingly seriously by funders. So now we've got all of the data in one place. You can do some exciting technical meta-sciencey type things. So, for example, you can look at the proportion that match grants in our UKRI database. So you can code all of the ARIs by topic, by method, by population, and then you can match them with grants. And what this slightly complicated table shows is that most of the ARIs, most departmentalised, can be at least partially addressed by grants in our Research Council's portfolios, mostly in the Economic and Social Research Council. So, for example, 88% of our work and pensions ARIs can be addressed through existing research done by funded by ESRC. It also means that you can, flip it the other way and say, well, what proportion of any of the research funded by our funders is relevant to policy? It's a bit lower. It's more like 30%. So I don't share that finding quite so frequently. But anyway, so the ARIs are definitely influencing funders. They're definitely influencing researchers. We did a really cool bit of sort of data tracing where we found some areas of research interest that had been cited in grant applications that had followed, that came out a year later. So they definitely influenced it. Those grants led to some publications, and those publications were cited by later policy documents. So really nice sort of closing the cycle where we can see that the ARIs are generating these changes all around the system. So that we were very excited by that. But it also means that we can start to ask more intelligent questions about why these ones have happened, where more support might be needed, where the gaps and gluts are. So the ARIs, Annette and I like to talk about them as being a Trojan horse because they sound so innocuous. They're just sort of, could you possibly put together a list of your policy evidence needs? But actually they're this incredibly strategic tool, probably much more strategic than I realised at the time. They're starting to leverage national research funding towards really important policy priorities, but in a way that's actionable. So it's not just sort of high level, here's our missions, we want to keep people out of hospital, or we want to reduce crime. They're actually policy specific in ways that researchers can actually address. So they're intended to improve connection, but most policy organisations need a lot of support to make the most of ARIs. As I mentioned, quite a few try and second researchers in. That can be helpful because, capacity within departments is often very limited. And there's a lot of pressures on headcount and that kind of thing across the board at the moment. But researchers generally, what they want to do is come up with research agendas, and, they've got their own sort of questions and interests. If they stop being policy-led or a reflection of the policy need, then they actually cease to be particularly useful. So it's something to be wary of. And of course, we just need to be mindful the whole time that engagement has costs as well as benefits. While it's really, while it's often really helpful to get researchers and policymakers together, it can have downsides. It does take a lot of time and planning. And researchers, with the best will in the world, we're not always the best at making the use of other people's time and expertise. So I think we do need to be quite mindful about how we leap on these when we first started getting involved with the areas of research interest. I was talking to one of my colleagues, an official in the government department, who said that they had 40 requests from different universities for ARI related workshops on one day. And you think that's not very helpful of us. I feel like as a sector we can do better. Yes, so this is just a sort of, there are a lot of practicalities to do with engagement, but we don't need to go into those. Happy to talk about it in the Q&A if that's useful. And I suppose in general, where are we at with the ARIs? People really value them, but we're learning all the time about what a useful response might be. Intermediaries like funders, think tanks, national academies often play really important roles in strengthening the system, but they're a bit sort of under-recognized because they do things like convening or bringing together, holding conversations, holding memory over time about what's happened in a policy field, and that kind of thing. Universities are less good at doing that. They're more interested in PR, if I can put it like that to you. They want to promote the work of their own employees, their own staff, and so on, rather than think what's the most useful response that we can make for this department, for this policy customer. There's also a bit of an issue with the data environment. We had quite a few conversations with different funders, not HRB, about what have you got in the back catalogue that's relevant to these ARIs, and actually they didn't have the data systems available to answer that question a lot of the time. So what we do have has been done through publicly available data rather than working with funders, which would obviously be preferable. So I think the question for us is, how can we work together for a more fruitful system? What we've tried so far is let's everybody do our own thing and have 1,000 flowers in bloom and see what happens. We've still got our innovation hats on. But I think the reality is that we are starting to understand more about the costs, if not the benefits of engagement. So at the very least, we can start to be a bit more mindful about the questions that we're asking. A lot of research impact and research engagement activities are still very directed at individual researchers or projects, but actually we need to start thinking about what does the overall system need, recognizing that when we try and engage with it, we're making demands of other people. So we're potentially weakening the system rather than strengthening it. But it's an open question for us all, really, thinking about what does it mean to move from the relational to the systemic. Sometimes for researchers and for universities, that's going to mean saying, not me this time, you need to speak to somebody else. That's going to be a new thing for some people, self included. But I just wanted to leave you with this tension between research impact and public service. A few years ago, some of you would have heard me say this anecdote before, so I apologise. But a few years ago, I was talking to a colleague from the US who was a researcher, and then she went to work for a funder. And after she'd been there for a few years, she decided to go and get a job in a federal child statistics agency. And I asked her why, she seemed to be having a nice time. And she said, oh, she just wanted to return to public service. And I thought that was such an amazing phrase to hear from an academic. And it's not something that we talk about in the UK, really. When what she meant was, I've got a set of skills, I've got some knowledge, I've got some expertise, and I would like to put it to work. I'd like it to do something useful for society, for other people. But actually, the conversation that we often have about research impact is how can you make the most of what you do for your career, rather than for others, or even occasionally for your university. But we don't talk about putting our knowledge and skills at the service of the nation or of public in general. So I think that's an interesting tension that we are still grappling with in the evidence use space. And I will stop there. Thank you very much. Stop sharing. I can.
Brilliant. Thanks a million. Kathryn, you covered so much in that space of time. I hopefully you have a glass of water or something there beside you. You can you can draw a breath because you've been full go there for that tilt. And thank you so much from that. I mean, if you don't mind, and if the audience doesn't mind, and I could encourage you to get questions in on Slido. But I suppose I'm going to go back to when you started the conversation. This is something that we're asked a lot about, and you started by saying, and I was working as a knowledge broker and so my question is, like, who decides who is a knowledge broker? How you know, how do you define a knowledge broker in that context? And maybe it goes back to the kind of strategic leadership and the systems bit as well, you know, because maybe your answer is that there's no one way of describing it, depending on whether you're at maybe the producing side, or whether you're from the policy side, or whether you're in an intermediate working on behalf of the system. But I'd just be really, really interested in that, in terms of what's a knowledge broker, who decides if you're a knowledge broker, could you have been a knowledge broker for years and not even called yourself that? And at the end of the day, on somebody's organizational chart, which at the end of the day, if we're going to talk about systems, sustainability, and so on and so forth, like, you know, where do we need to see more kind of brokers popping up in our system? So
Yes.
bit of a woolly question, but one that is actually quite difficult. We use brokerage and knowledge brokerage a lot, but actually, what is it? Who is it? How do we?
Yes, it's a very good question. I think in very prosaic terms, the reason I called myself a broker is because the work that I was doing in ghost science wasn't considered to be research. So I was funded through a practice-oriented bit of the Economic and Social Research Council. So I was on a, you know, a doing grant rather than a researching grant, which I think is a bit silly because we ended up having to do sort of stealth research. But you know, I actually don't think knowledge brokerage is a very helpful term. You know, a lot of people have spent a lot more time thinking about it than I have. But then we think about the other things that are brokered, you know, deals, marriages. It's all about sort of connecting to communities. And I don't think the communities are that separate, really, between evidence producers and evidence users. There's connections everywhere we go, really. I did spend a little bit of time going into thesaurus and looking at alternatives. So I did get to emissary, which I quite liked, but I'm not grand enough for that. Or hired gun, you know, someone who goes in as a sort of problem solver. But I'm definitely not glamorous enough for that either. So I don't know. It's very much a self-identified profession. And I know there are colleagues in UPenn, Jonathan Brecken, for example, who's done a lot of work thinking about what capabilities and careers look like in that space.
Yeah, no, interesting. And look at maybe something that, again, you know, for our December conference, we might discuss and tease out a little bit. I mean, yes, for me, it's often a case of what are we trying to do here? What skills do we need? What type of people do we need to do this job, and where do they need to be based or situated within? So it can be a bit fluid depending on what you are. But I like the kind of problem solver, the connector, somebody who has no sort of particular skin in the game other than to make it work. But again, our audience will have lots of views on that, and I hope to build that discussion, because it's just a word I think it's positive that we're using a lot more in a research context, but I'm not entirely sure we know sometimes what we're always talking about. I loved the Metro map. I really liked that. Well done to the graphic designer, but they obviously had some good stuff to work on in order to do that. And I think probably there would be very few people on this call, or in any call on this topic, that won't resonate with. It's very messy. There's lots of lines. We saw the same here, you know, during COVID. We're Department of the Taoiseach. We had, you know, our CMO. We had our NFIT. We had an advisory group. We had an advisory group to that advisory group. We had various different organisations, and it looks quite messy, but actually it probably is a good articulation of what it's like in real time as well. I was you talk, and I know you've done a lot of work in the kind of skills and capabilities perspective, and you talked about how the skills are different at the kind of I'm almost going to call it almost the specification, or defining what the ask is, the producing side, the mobilizing side, and the using side. I just wonder if you'd say a little bit more about that, because I do think sometimes we come to it thinking it's one type of person and one skill set is going to do everything across that. So just any reflection that you would have on that sort of skills and capabilities piece.
And we often think that you know, if you are going to have research impact, on one of the papers that I've written with Paul Kearney, it looks at this advice that we give to researchers. And if you followed all our advice, you'd have to be a sort of fully fledged entrepreneur, as well as a brilliant networker and a, you know, a superstar researcher and all the rest of it. And no one can do all of those things. No one wants to do all of those things. You know, as I said, it's pretty unusual people who do it successfully. And that's not to say that they're particularly brilliant at it. It's just that the system is set up to receive a certain set of people at the moment. But to take an example, when science advice is being delivered in the UK, it's delivered between the chief scientists in every department speaking to ministers. That's the delivery bit. So it's a conversation in a room between people who are asking what would happen if. Those are the questions that come from Cobra or from the ministers. What are the implications? What if we did this one versus that one? And the chief scientist's job is to answer those questions and to try and make them aware of any risks or mitigations and that kind of thing. That's a very different job than sitting in a room as chief scientist, listening to 60 scientists thrash out the pros and cons and the strengths and weaknesses of the evidence base in answer to some of those questions. And the job of being a committee member, which is what most people, what most researchers did in the end in contributing to the sort of COVID response, was sit in a committee room and try and understand what is the specific contribution that they've got to make. So a lot of that job is about listening as much as anything else and trying to understand, do I have something to say about this question? If I don't, maybe I should be, keeping my mouth shut. If I do have something that's really directly relevant, how do I make it in a way that is going to land with the chief scientist and so on? And then there's all the people in the research teams who are sitting behind each committee member, whose job it is to run analyses and to do the epidemiology or whatever it is, and then to write that into a format that can be taken into a committee room. So very different skills, and actually not any of them prepare, universities don't prepare you for any of those jobs really. So yeah, there's a lot to get your head around.
Yeah, no, I think I think that's really that's really helpful, and I think really helpful to have your bringing us up to speed on the areas of research interest in the UK, and just generally what you've learned from that, and your take home messages from that. And again, for those who are registered for the conference in December, we are hoping that one of the sessions will actually take kind of a pulse check. Where are we at in Ireland in relation to our government capability within departments for what we're talking about here, and who has they're not. I don't think there's a common name. We've got a statement of research priorities, we've statement of needs, and so on. I suppose we don't have a system-wide kind of common approach to that as yet, but our fairly new Department of Education, Science and Technology and so on has recruited a chief scientific advisor to government, are starting to put in advisory structures, working with civil service departments in terms of a kind of an evidence or a research network, surveying around capabilities and seeing who has produced, I suppose, what we would otherwise call ARIs here. So I think it's really, really timely for us to learn from what you have learned so far in that context. And certainly something that we as funders have been interested in. We do, and people on the call will know that, when we put calls out, we do promote the Department of Health's statement of research priorities to try and give a line of sight and to help people. We don't currently, there's no weighting in our assessment criteria. However, particularly in applied schemes where you're looking to talk to policy priorities or so on, it's certainly not going to do you any harm to join the dots in relation to that. And that's not to say that won't change down the line as government departments get better in relation to that. I have a question for you, and there's I'm going to jump with one more before I go on to Slido where they're piling in here. And while you're answering this one, I'll give me a chance to look at the other ones. But I suppose one of the things that certainly I grapple with is in terms of, I agree with your kind of relations to a systems approach. I think it's very pleasing. We're seeing a lot of work going on at the level of our academic institutions, discussing and debating this and saying, how do we do this better? What do we need to do and so on. I was struck by your your comment and your terminology around I'm going to call it institutional PR, and I suppose it is something I was sitting in the Department of Health during COVID, and I was really struck. It was a new environment for me by the number of I'm going to call it one-off researchers, or indeed quite sophisticated approaches of universities to make sure that it was their name and their people that were being cited in terms of advice and so on. And just how to your mind, or what could we do, or has anybody tried to do anything in that systems approach where we actually bring the power of the many researchers across institutions into some sort of a coordinated entity or mechanism that then can engage at a kind of a high priority cross-cutting ARI level, if I can call it that, because it sounds awfully complicated and complex and maybe Nirvana-esque to me, but would you have anything that perhaps we could even think about or look to anywhere where it is beyond researchers, beyond centres, and indeed beyond institutions in terms of brokering with the decision maker structures at policy level?
Great question. So I think, I mean, look, a lot of this activity comes from a good place, doesn't it? And universities are trying to be helpful, and they've heard the message about research impact and why it's important, and they've invested resources in it, and that's all a good thing. So I don't want to be too down on it, but the truth is it's not cost free, as I said. So more coordination is definitely welcome. The question is who should be doing it. So one option is for government to do it itself, and for it to have capability in each department to keep abreast of all of the the different research groups who are working on relevant topics, and then to do its convening appropriately. They generally don't have time and capacity to do that. So often they're very reliant on things like the national academies or sort of learner bodies to do that. And they can be quite good at looking across disciplines, certainly across different organisations. So that's one option. In the UK, they've a few universities started a sort of umbrella organisation called UPenn, the University Policy Engagement Network. So it started by colleagues outside the Russell Group. So I think it was mostly Southampton. So I can't remember who else got involved, but it was Gavin Costigan at the time, who was like the university's policy impact officer, or whatever the job title was, recognizing that it's always going to be very difficult to compete with London, Oxford, Cambridge in terms of access to Westminster particularly. And so would there be value in trying to collaborate rather than compete with each other, given that we've got 140 odd universities? And that's, to some extent work. They are actually talking to each other more now, and they've just received some funding from Research England, which is our sort of block university funding mechanism, to think about what sustainable university engagement infrastructure might look like, recognizing that there are inequities in the system and we need to be thinking about inclusion and all that sort of thing. So there's some quite exciting developments there, but I think you have a real opportunity in Ireland, because you all know each other. It's much more possible to know the individuals involved and to have meaningful relationships between them, and to do some of that collaborative, not competitive work together.
No, thank you for that. A couple of questions just coming in. And you did make reference to this, but I think the question is, you've mentioned that it takes time to generate the statements of need or the ARIs, and it takes a good bit of support skills and time and approvals and all of those types of things. And the question is, did all departments do this? I mean, you've showed your grid of all of the difference. Was it compulsory? Did they do it? Were they working to a common methodology? Or if you just say
a bit more about that. Yeah.
A bit more about that. There's some questions.
Yes. Well, so it was sort of officially compulsory, but the Government Office for Science doesn't have an executive role, so it has a sort of soft power. We were relying on our charm to persuade people to do it, in a nutshell. So we got quite a long way, but not all the way. But some interesting things happened. So, for example, we've got lots of arm's length bodies who they wanted to have ARIs, but they don't have ministers. So how did that work? So, for example, spent quite a lot of time talking to colleagues in HMRC who don't have very good connections with the research world. They thought they could do an ARI, and then maybe that would encourage researchers to see where they could contribute and be helpful. But they're sponsored by Treasury, and the Treasury didn't want to do ARIs. And it was very difficult for us to engage with them. And they just wanted that, as far as they're concerned, they've got their chief economist, and that's fine. So we didn't hear anything for a couple of years. But it turned out that because HMRC were pushing it from the inside, they realized they would have to have their own set as well in order to incorporate the HMRC interests. So HMT published theirs earlier on this year. So I felt like I needed a Blue Peter badge after that one. I can't mean I don't take any credit for it, but we did get the full set. But lots of different parts of the pool of the public sector are doing it now. So Sports England published theirs yesterday, Crown Prosecution Service, Metropolitan Police, a bit weird, they've done some. But lots of charities are doing them. And it's just making it much more obvious to people where they've got shared interests and where we can, be much more aligned and strategic about our use of research resources. So for some, some departments were really up for it, typically those who were, keen to get more researchers involved, but didn't have a lot of research budget and so need more help. But I think they're all starting to see that it's not just about leveraging stuff out of the academic community. There are other strategic benefits to doing them as well. So, it's the sort of thing that I think once it takes on some momentum, it keeps itself going.
Absolutely. No, thank you for that. And somebody has asked if you could give an example of an intervention or interventions that has been delivered to improve decision maker skills or capacity for improved uptake of evidence.
Yes, great.
Particularly to point them towards there.
Great question. So the Sachs Institute in Australia have done a huge suite of interventions and really robust interventions, which you can look at. They've done a randomized control trial, which I think was called CIPHER. But there are a number of capacity building interventions where people, officials and ministers are offered one-to-one mentoring and training that has, demonstrably increased the amount of evidence that they feel able to engage with. So I'd start with them and see if that fits.
Excellent, yeah, and indeed, just as a throwback in terms of the establishment of the evidence centre here in the HRB, actually we modelled it on some of the Sachs Institute's early work. So and they've been over with us before, so that just might be something for a future engagement and perhaps even a side conference or a webinar with the community, and that might be interesting in a flashback. Somebody else has asked or said the rise of political ideologies makes it even more difficult to have objective evidence used. Are there any emerging methodologies to help cut through this?
Cut through the political ideology?
Yeah, and I suppose, well, or ideologies, political or otherwise, that will likely always exist, but how to ensure that objective evidence is used, perhaps my words, maybe despite that. Just reflecting the reality and perhaps how to take that into the evidence for policy process.
In my experience, there's no tried or tested recipe for success in this space. Sometimes you're going to be you'll have a willing ear, and other times you won't. But you have to be ready. That's the message I give to researchers: is be ready when the opportunity comes along, and make sure that you've done everything you can to keep the relationship sweet and the door open. What you don't want to do is rule yourself out of any conversations by saying something daft on Twitter.
Good answer. And you mentioned earlier that, and I know there'll be a lot of people on this call, and we get asked about it a lot, as do other funders. Very similar to the I suppose the context you described across the UK, where fellowships. I'm going to call it fellowships, placements, secondments, interns. I'll expand on the kind of fellowship and variations thereof is something that people are more interested in, both from the researcher side, thinking, well, as part of my development and understanding what this policy making and decision making lark is, and understanding the cycle, and perhaps building my skills in that and exposing myself to that, and then also from the the kind of the departments of the ministry's perspectives in terms of, I suppose, growing capability, the capacity, and so on, and that. you said that, like, and I think you set it out very well. Like, the different things will deliver on different things, but then won't deliver on other things. And fellowships and such like, they're valuable in certain circumstances, depending on what it is you're looking to get out of it. Would you, as a funder, and as many people who are on the call who perhaps would be thinking, is that a route maybe for me, and would that improve? Where do fellowships? What would you articulate as the real benefits that derive from fellowships, secondments, placements, and internships, etc., in policy departments for those who are currently in the kind of, I'm going to call it the research, although that covers a multitude.
Well, I think the evidence on fellowships is mostly from the clinical space rather than the policy space, but I think the lessons hold true. What generally the evidence shows is that the fellow has a great time. They develop lots of new skills, lots of new networks. They, learn loads about how the other organization setting works. And then when they take that knowledge back to their host or their home, the university in my case, the university turns around and says, okay, well, you've had your fun. If you could get on with your day job now, that would be great. And they don't know how to make use of the new knowledge and networks you've got. There's just an incomprehension about what it means, really. So typically fellows become serial fellows. So as a funder, what you're doing is you're supporting a cohort of hybrid people who, are really helpful and developing and learning lots of new things, but the system's not ready always to receive their, where do they go next? How can we make sure that the universities are ready to make the most of them? And on the flip side, it's very difficult to say, but I would say ministries probably get something useful out of it 30-40% of the time. It takes, talking to a colleague in our parliament, they run a fellowship scheme, and she estimates it takes 80 man hours just to get someone through the door into a fellow post. So that's in terms of recruitment, hiring, all the HR. That's before you set up a project for them or doing line management or any of that sort of day-to-day support. So they're very costly for a host organization. And sometimes researchers don't always come in thinking, well, I'm happy to run analyses every day, or, they've got their own things that they want to get out of it. They want to get a paper out of it. That's not what fellowships are for. Sometimes you'll get lucky and you'll get a candidate who's really keen to just be helpful. But that's generally not rewarded by the university. So they can be a bit hit and miss.
No, I think I can relate to what you're saying, having been in the department and had people come in and feeling that it wasn't what their expectations were, and also but that's really, really helpful, I think, just for us to think through from the different perspectives. And a final question, because I know we've gone over. I mean, have you seen in that sort of systems approach and that kind of incentivizing the improvement that we've talked about here that's needed in this evidence for policy space, reducing waste, duplication, refining it, and so on? Have there been many changes in the kind of recognition systems or the incentivization systems in academic departments? Maybe not directly linked to the whole move to areas of interest and governments doing this work and trying to coordinate this work. But has there been a shift in terms of what gets valued, rewarded within and without?
It's too hard to say, really. I mean, it's generally part of all of our job descriptions as academics anyway, but it's perfectly possible in lots of organizations, lots of universities, to opt out of parts of your job description without too much pushback. So, it's there if the levers are there if anybody wants to push on them. But at the moment, I think it's left up to the individual to decide if that's something they want to support. And maybe we just need to think about that a bit more carefully as a profession.
Yeah, no, that's interesting, and I think we'll probably reflect the situation here as we think for similar in that. I'm conscious that we've gone over time. You have certainly indulged me with a lot of questions. Thank you for those who put questions in on Slido, and I hope I've managed to get to most of them. Kathryn, it really just remains for me to say thank you. Thank you for your time today. And I would really encourage people, to look at the Transforming Evidence site, look up really, really valuable, I think, openly available publications from you and some of the colleagues that you have mentioned. They're very thought-provoking. There's some really, really interesting frameworks and ways of breaking this down into bite-sized chunks notwithstanding, it's a complex and messy systems issue, and we look forward to maintaining this dialogue with you. I'm sure, and it won't be the last that certainly the broader HRB community hear from you, and indeed I've already warned you that the HRB itself will be chasing you after this. Thank you to everybody who joined us today, and like I said, if you have not looked at previous recordings in our Evidence for Policy series, please do go onto the website, social media channels, and please do register for the conference. We really, really want to bring you into this conversation. This is just getting us in the mood and tweaking our neurons so that we spend the day on the 3rd of December trying to get through as much as we can. So thank you, Kathryn, for joining us today, and everybody have a sun is shining here. I hope it is where you are, and have a lovely afternoon, and hope to be in contact again soon. So thank you.
Thanks so much, Teresa. Thanks everyone for a lovely discussion. Bye now.
Thanks, Kathryn. Thanks a million.
Cheerio.